All right, welcome to our Association Health Plan webinar. My name is Annette Ashley. I'm with the State Bar of Wisconsin, but with us here today is our special guest, Wendy Block. Wendy is a benefits specialist with the Professional Insurance Programs, and it is the Professional Insurance Programs group that is administering the Association Health Plan specifically for law firms. So with that, I will turn it over. I want to just make one more mention for anyone that just joined us. And that is that if you have questions, feel free to put the questions in the chat box. I'll be reading those to Wendy, and please feel free to ask questions as we go along. And with that, I will turn it over to Wendy.
All right. Well, thank you very much, Annette, for that very nice, warm introduction. As she had mentioned, my name is Wendy Block. I am a senior account manager within the benefits department here at Professional Insurance Programs. I've been with Professional Insurance Programs for about 5 years now. In the industry itself, just over 22. So I want to say again, welcome and thank you, and I am looking forward to this. Today's agenda, we will do a brief recap of the 9 health plans that are available. We will discuss the 15% discount in rates for groups with 2 or more enrolled employees or attorneys. We'll discuss the enhanced emergency room, x-rays, and lab work. And then I will dive deeper into the value-added services that come along with the program through WPS and your State Bar Association Health Plan. All right, so the 9 plans that are available. We have 5 copay plans and 4 high deductible HSA qualified health plans. From deductible levels, we actually start as low as $750 and go to as high as $6,550. So the nice thing is, with a variety of health plans, as an employer, you can actually offer more than one. You don't have to have the same health plan for yourself as for your employees. You can actually lock in your contributions on a higher deductible health plan that's going to have lower premium, and then allow that employee to buy up to a different plan that might be better suited for their needs. Plan types. We mentioned we have copay plans and high deductible health plans. Copay plans are very common in that they are traditional health plans that have first dollar coverage included in the programs. So if you go to a doctor, you might pay an office visit copay. You'll have prescription drug copays, things like emergency room copays and emergency room copays as well. So in a copay plan, not everything is subject to the deductible. Now, on the opposite side of that are high deductible health plans that are HSA qualified. When the government created high deductible health plans that are HSA qualified, they said that everything must go towards your deductible with the exception of preventive care. Preventive care is the only service that is not subject to the deductible. But if you go in for a doctor visit, lab test, prescriptions, all of that will be subject to the deductible first. So in this example, we have Jane, and Jane actually has a high deductible health plan. It has a $1,500 deductible, then it has 80/20 coinsurance or cost sharing, and has an out-of-pocket limit of $5,000. In the first example, Jane has not reached her deductible yet. So she has a doctor's office visit. That visit costs $125. Because Jane has not met her deductible, Jane will pay the full $125. Now, Jane won't be asked for that at time of service. Under a high deductible health plan, claims typically go toward the to the insurance carrier first, get discounted accordingly, and then are processed, and you will receive a bill. It's always important to match up your billing statements to your explanation of benefits. I tell clients all the time, don't pay a billing statement until you have an explanation of benefits to match, because sometimes they jump the gun. In the second example, Jane has reached her $1,500 deductible, and this is when coinsurance begins. Coinsurance is cost sharing between you and cost sharing between the insurance company. In this example, we have a $75 office visit copay. Because the deductible has been met, Jane is only responsible for 20% of that $75 charge, which is $15. So Jane will get a bill for the $15. Her plan would pay 80% or $60. And then in the last example, Jane has reached her out-of-pocket maximum of $5,000. She has an office visit charge, which is $200. Because the out-of-pocket limit has been met, Jane does not owe anything. All right, so before we dive into the value-added services under WPS and the State Bar Association Health Plan, there's two very unique features that are built into particularly our copay plans. We have an enhanced emergency room coverage, and we have enhanced X-ray and lab work. Typically, in a health insurance policy, when you go to the emergency room, you pay a copay, it's subject to your deductible, and coinsurance thereafter. Under WPS and the State Bar Association Health Plan, the copay is only $300, and then the deductible itself is waived. So it goes straight to the 80-20 coinsurance. Or if you have 100% coinsurance, your only responsibility is the $300 copay. The same thing goes for labs and blood work. Again, that deductible is waived. So there's no copay for X-ray or lab work. It goes straight to the 80-20, or if you have 100% coinsurance, it would be covered at 100%. All right, so here is a list of the no-cost value-added services that we're going to talk about today, and it compares to other health insurance plans. Notice that it can vary when you have other insurance carriers involved. In some cases, I've seen maybe virtual visits. I've seen maybe preventive services because of the Affordable Care Act. But a lot of these, I have typically seen where they might actually no longer be part of the health plan in an attempt to save costs. WPS definitely wants to continue to promote their value-added services, and they continue to add them to their health plans. From a customer service standpoint, WPS is celebrating 75 years of local service in the Madison area. What I like about that is we have local people serving our clients. So it's Wisconsin helping Wisconsin. In other carriers, sometimes they may be out of state. In some cases, maybe even out of the country. Preventive services. So this is our biggest and most popular value-added service, mostly because of the Affordable Care Act. Under the Affordable Care Act, preventive services must be paid at 100% in network at no cost to you. Now, it's important to make sure that when you do have your preventive care services done, that they are coding them correctly. Oftentimes, I'll get phone calls and they'll tell me that their exam was not covered or that their mammogram was not covered. And a lot of that may come down to coding. Preventive care does have its own special coding that needs to be sent to the insurance carriers for processing. But under preventive care, things like immunizations, medical exams, routine diagnostic services, well child care, mammograms, preventive screenings, and a lot more are covered at 100% at no cost to you. Another one of the common questions that I get is in regards to colonoscopies. Now, colonoscopies can be tricky because, again, it comes down to coding. I've seen it, not often, but I have seen it, where a colonoscopy can change coding. It all comes down to whether they would find polyps during that procedure or not. I also want to note that back on May 15th of this year, the United States Preventative Task Force lowered the screening age from 50 to 45 for a colonoscopy. And WPS has already adopted that contract language. So if you fall between the age of 45 and 49, and your doctor is recommending that for you, just know that that is part of their program now.
Wendy, we have a question that has come in our chat box.
Sure.
And, someone is asking, what are preventative drugs?
They're jumping ahead to the next screen.
Okay.
So we're going to talk about preventative drugs. So under preventative drugs and copays, preventative drugs for common conditions have no copay. Now this can be a unique thing through WPS and the State Bar Association program. I have seen it with some carriers, but it may not be as expanded as this list. When Annette emails you the full PDF version of these attachments, this is actually 2 pages front and back. So some of the common preventative conditions might be things like high blood pressure, high cholesterol, diabetes. We'll get into things like ACE inhibitors, respiratory, mental health, and a lot more. So that's why I wanted to make sure for everyone that is attending, they get this list so they can take a look at it. Any other questions on that? Okay. All right, exercise rewards programs and active and fit. For those of us that enjoy getting out there and exercising, why not get rewarded for it? There is a $30 reward that you can receive each month for visiting a fitness club 10 or more times in that month. Now, under the exercise rewards program, there's actually 8,000 contracted, but over 30,000 different fitness facilities nationally. So fitness, it includes large fitness chains as well as independently owned clubs like the YMCA and YWCA. What I like about this is a customer can be yourself as an employee, your spouse, and dependent children over 18 years of age. Active and fit. Active and fit might be for those that may not have started the exercise rewards program and wants to potentially find a fitness club. There are substantial discounts on your membership fees at over 16,000 premium and standard fitness locations and memberships. If you like to work out on demand, that's okay. They got 4,000 plus different videos that you can do for workouts at home. There's no long-term contracts, and the starting cost is $25 per month.
Wendy, we have another question.
Sure.
What about remote employees? Are out-of-state employees eligible? Are there out-of-state providers still within network?
In regards to the exercise rewards program, I'm assuming?
I think just in general is providers as in healthcare providers.
Okay.
And I'm sure they're probably talking about firms that have now that we have the ability to have remote employees from out of state,
Sure.
how does that impact the network that's available to them if they're out of state?
Well, the nice thing about WPS and the State Bar Association Health Plan is that there is a national wrap, and that wrap pretty much covers you coast to coast. It is through First Health Network outside of the state of Wisconsin. So if you do have employees that may reside in, Florida or Illinois or wherever they may be, as long as they can access the First Health Network, they're going to have in-network care. Okay. And then in the state of Wisconsin, we've got two different provider networks to choose from. The first one is our statewide provider network. The statewide provider network is very robust. You are pretty much talking about 98% doctor hospital concentration inside that network. The only time I have seen the WPS statewide network not have a doctor is if they're an independent specialist. So again, I always recommend check your networks before you go to a new provider. It's very important. But from the care system standpoint, especially I'll use the example of here in southeastern Wisconsin, it has Ascension, it has Aurora, it has the Freighter Children's Medical College, ProHealth, and the list just goes on. For those that like to be a little bit cost savvy, and depending on what county your business resides in, there's also what is known as the WPS Select Plus. Now, the Select Plus is a skinnier, more limited provider network. And that is about equal to 70% of the big statewide provider network. So you're not going to have every major care system available to you, but it provides you with cost savings in those premiums. So instead of having maybe 3 or 4 different care systems to go to, you might only have 1 or 2. Okay.
I want to follow up with another question related to the remote coverage.
Yes.
Since so many people are finding themselves now employing people outside of the state.
Mhm.
I think you referred to the First Health Network as that out-of-state network that they would have access to any healthcare provider that was in the network. Does that network also include hospitals? Or is
Yes,
that,
it does.
okay, so that is included then as a resource outside of the state. And then my other question is, I also, and you may be covering this later on, but I also thought that this plan linked to some out of state care that was seen as additional expert sort of care, like the Mayo Clinic, for instance. And I wondered if you could maybe touch on that because of the question that came in on the remote employees situation.
Sure, I'd be happy to. You are correct, Annette, that WPS does have a contract with Mayo Clinic, and not everybody does. So if they want to go to the Mayo Clinic, they can definitely do so, and they will receive in-network benefits.
And again, I would assume that Mayo Clinic network is where, because they have many spots outside of Wisconsin, it's any of those would be available.
You are correct. I would, again, we always want to double check the provider network because, with WPS, I'm typically referring to Mayo Clinic in Minnesota, in Rochester. So we would have to double check the provider network for those around other states. I can't say conclusively yes or no. I would definitely recommend we double check. And the nice thing is, if we bring on a law firm and their employees are struggling with finding a doctor, whether it's in the state, outside of the state, they can email us, they can call us. We provide that service to our clients in addition to calling WPS's customer service or going online. So if somebody needs help, we're also a resource for them. Okay?
Thank you.
Okay, moving on. All right, telehealth services. So, you know, it's interesting. We were talking about remote employees. Well, it's time for us to get comfortable with almost like a remote doctor. And telehealth or telemedicine is available through WPS and Teledoc. Teledoc gives you 24/7, 365-day access to US board certified doctors through the convenience of phone, video, or mobile app visits. There's 3 different levels of care that you can gain access to. And depending on which level you need to gain access to, the price starts at a $50 charge and then may increase depending. So the first level of care would be general medicine. This would be for I've got a cold, I got a flu, I'm not feeling well, and I just want to talk to somebody, have them write me a prescription so I can feel better. Teledoc is great for that. If you can't get in to see your regular doctor and you don't want to go to urgent care, and you definitely stay away from the emergency room, this is a great way to obtain that prescription that you might need. There's also care for mental health. So if you want to speak to someone in regards to anxiety, depression, stress, marital issues, you name it, that too can be done via phone, video, or the mobile app. And then there's also dermatology. Now, believe it or not, you can actually take a picture of your infection or what might be going on your skin and send that to them, and they will review that and provide you with some help under the dermatology application that's available through the Teledoc services. Okay, iMed Vision Care Discount Program. So this is a program that is a discount service only. It's not really insurance, but it does provide you some nice discounts when you need to obtain glasses or contacts. I actually have used this myself. And what I do like about it is it did save me on average between $150 to $200 because I needed bifocals. So it includes iMed providers. So there is a network that you do have to go see. And those can be Lens Crafters, Pearl Vision, Target Optical. There are many, many more. There is a 35% off retail price of frames, 15% off retail price of contact lenses, and there's even a discount for LASIK, if that might be something you're interested in. Here in America, this is another discount program that is built into your WPS State Bar Association health plan. There is a free annual hearing screening for you and your extended family. Now, this is unique. Extended family, that includes all blood relatives, adopted family members, domestic partners, and in-laws. So it's nice that if your parents might need to obtain a hearing exam, you can give them this information and they can get it for free. It also includes up to 70% off MSRP, 3-year repair and warranty, loss warranty, and 3 years of hearing aid batteries. Plus there's financing available. Pulmonary care program. So this is actually brand new to WPS. It's about only 2 months old and they just rolled it out. So this helps those that are attempting to address their asthma and COPD challenges. Many of us that have asthma or COPD are probably already on an inhaler. With the Propeller inhaler sensor, it attaches to the inhaler and it gathers information about your medication use to share with your doctor. And it also has many features like medication reminders, automatic tracking, logs and trigger discovery, a daily forecast, reports, and a lost inhaler locator. That's pretty handy. Okay, Express Scripts mail order. This is probably one of the most underutilized benefits that our program has through WPS. Many people may not realize that they can obtain their prescription drugs through the mail order, and with WPS, they use Express Scripts. So for those that may have copay plans, it's a 2.5 copay for a 3-month supply. So it's a half a copay savings over the course of 3 months. Those that may have medications that fall under tier 2 or tier 3, this could be substantial savings. For those that may have high deductible health plans, it is an average of 5% that you will save with better discounts buying through mail order. So this is common. They always say the more you can buy in bulk, the less expensive something will be. And that is very true with prescription drugs as well. So this mail order program is available to both the copay plans and the high deductible health plans. Now you can do this through WPS's website. You can go to Express Scripts website. Express Scripts has an app. And for those that still like to do paper, there's even a paper app form that you can complete and submit into Express Scripts as well. So this completes our deeper dive into the value-added services that are included with WPS and your State Bar Association health plan. Are there any other questions?
Now, I know we may have some folks here who haven't had the option of seeing some of the other video webinars that we've been putting on from time to time. So feel free, if there are questions other than on these value add benefits that Wendy has just gone over, feel free to throw those questions into the chat box. There's a question here from one of our participants asking if you could go back to the prior screen with the 9 plans that you had, and that may raise some questions.
How does that, is this the one we want to talk about or look at?
And feel free if you have, so the response to this is yes, so we hit the right slide.
Okay.
But feel free if there are more questions you have about the mechanics of how this works, and this is the first time you're with us, feel free to put those questions into the chat box. We want to be able to give you information that you're looking for to help you take a look at this option as a possibility.
If I may jump in, one of the questions that I do get all the time is I get a call almost every day, sometimes twice a day, from sole practitioners or sole proprietors, and those that may not have any other employees and it's just themselves. And boy, I do wish that we could offer this to them, but a health plan requires at least two employees or 2 members. So whether it's an attorney and a W-2 employee, or 2 attorneys, it can't be husband and wife. Unfortunately, we don't allow that, but we can write a health plan of 1, but we still have to have 2 to start. Now, even if that second person waives because they don't need it, and we still want a health plan for 1, great, we can do it. But we still have to have 2 to start.
And I wanted to let you know there's another question that just was posted. Do the employees need to go through any medical screening to be accepted or get lower premiums?
Great question. Thank you. So let's talk briefly about the quoting process and also what that entails. So the quoting process is pretty simple. You can email me, there's information on our website. I know there's information on the State Bar website on how to obtain a quote. So preliminary rates are provided for all 9 health plans when we receive census information. Census information is simply gender, date of birth, type of coverage needed. And then we can email you preliminary rates for all 9 health plans. If you want to move forward and obtain final rates, there is medical underwriting. Because this is a large group association health plan, underwriting is required to secure final rates. There's no health exam or anything like that required. It's just an application with, I believe, 5 medical questions that you would answer yes or no to. And if there is yes, then there's a spot for you to provide details. Once we obtain those applications and waivers for anybody who would waive, by the way, waivers do not have to complete medical. We don't require that. We take that information to the underwriters at WPS, and then they provide us with final rates. And again, we can provide final rates for all 9 health plans. So even if you obtain final rates, it still does not lock you in to you must take this coverage. You still have the right to say, no, thank you.
Okay, your descriptions are prompting some more questions. Under the HSA qualified $2,500 deductible with the 0% coinsurance, does this mean that once you pay $2,500 out of pocket, insurance covers everything else? Or this person asks, am I missing something?
Good question. No, they are not missing nothing. Now, assuming that we are in network and assuming that that person has single coverage, it is a $2,500 deductible with 100% coverage or coinsurance thereafter. If it's a family plan, then we have to talk about what is called a non-embedded deductible. So we get into embedded versus non-embedded. That's why there's a little asterisk next to the plan description. A non-embedded deductible means that if an employee has family coverage, the family deductible must be met before the plan will pay any benefit. So for in that example of the $2,500 single deductible, the family deductible is always 2 times. So family deductible would be $5,000.
Okay, and so you referred to embedded deductible and a non-embedded. Can you just kind of give us a definition of embedded and non-embedded? I know you gave the example of the family plan is twice that, but is there a straight definition you can give us?
I'll do the best I can.
Okay.
Embedded versus non-embedded. Embedded is typically in your traditional health plans or your PPO plans, where you have a single deductible and then a capped amount per family, okay? So if I insure myself and I'm a family of 5, I may only have 3 single deductibles to meet. And no one person goes beyond their own single deductible, okay?
Okay.
In a non-embedded deductible, which you typically only find in HSA health plans that have a lower deductible of $2,850, I think, that's when they said that you have to have this combined one size fits all type of deductible. So it doesn't matter whether it's one family member or all 5, you're working towards one common goal of $5,000.
Okay. And I'm sure that changes depending on every situation you're looking at for an insured because of how you described it, a single versus a family. A family can be different sizes. So those are really good questions to connect with you directly on,
Absolutely.
to ask the specifics to be able to understand that more thoroughly.
Yep,
Perfect.
absolutely. It's something that, we get questions on all the time. And this again talks about part of our core services. This slide is meant to be a brief overview and highlight of the plans available. When it really comes down to the summary of benefits and what is covered and how do things work, that's when we can get involved.
Okay, we have another question that is looking at costs for the plans. And she points out references that you mentioned 15% discount in the intro. And how is that obtained?
So the 15% discount is actually built into the rates when we provide you with preliminary rates. So even though we can actually write a group of one will lose this 15% discount. So this discount is built into the preliminary rates and then built into the final rates. For those, it's in the category of 2 to 9. So if you have 2 to 9 enrolled employees or attorneys or any combination thereof, this happens to be where we are the strongest because of this discount. But that's not to say groups over 10 and above, definitely take a look at us as well, because being that this is a large group association health plan, we do not community age rate. Okay, groups 2 to 50, when you're looking at fully insured health plans, that falls into ACA community age rating. The rate is the rate for your age. And we do not do that. We actually composite rate. So we take the census and we blend it together to come up with one common rate. So singles, regardless of age, regardless of gender, will pay the same rate. Same goes for what we call a limited family and a full family.
Great. Does the employee need to be full-time?
Great question. We actually go down to as low as 26 hours per week. So if that employee does work more than 26, that is our definition of full-time. However, if your contract language states 30, then we match your contract language, but they do have to be a full-time employee.
Okay. For the HSA plans, do you also hold an HSA savings account? And if so, is there a credit card that is provided that the funds can be accessed from? And then a follow-up to that is there if there is a savings account, does it carry over from year to year?
Okay, HSA bank accounts. A couple of things we do with those. If we do set up a high deductible health plan and you are interested in an HSA bank account, the first thing that we typically recommend is going to your business banking partner or perhaps your personal banking partner and seeing if they have HSA bank accounts available. If they do not, we do have a third-party administrator that we really enjoy working with that will handle your HSA administration and banking needs for you. And then in regards to, do HSA bank accounts accumulate and roll over from year to year? Yes, they do. That's one of the things that makes them different from FSAs or flexible spending accounts.
All right, we have a question that goes back to the family deductible. So if you have any spouse or family member on a policy, you always have to meet the larger deductible first. And the question is, why is there even an individual deductible?
There's, under our copay plans, Again, we have what's called an embedded deductible. So it's a single deductible of, let's say, for example, $750, and it's a 2 per family deductible. So no one person can go beyond their own single deductible in a copay plan. So the reason we have a single deductible is because if you insure yourself as a single, you will only have one deductible to meet. If you insure yourself as a family of 5, you will only have 2 deductibles to meet, not 5.
Okay. There's a question that says, for the copay plans, is there a max out of pocket per year that coverage would move to 100%?
Yes, there is. On every one of our plans, whether it's a copay plan or even our HSA high deductible health plans, we do have an out-of-pocket limit. Now, again, when we provide you with preliminary rates through our quoting process, all of that information is provided to you.
Another question, we have a lot of questions coming in, so
Oh boy,
this is terrific.
oh boy.
What is a limited family?
Limited family. A limited family is an employee and spouse, or an employee and child or children. A full family is going to be employee, spouse, and child or children.
Okay. Which doctors does this generally cover in the area, UW or Dean? And or is that not the way it really works, is a question that's been asked.
Okay, so this sounds like might be Dane County region. In the statewide provider network, you will have access to UW and SSM Dean. However, again, if you would like to save some premium, you can always look at our Select Plus, which I believe is UW only.
All right, and then we have another question. If the firm has a husband and husband and wife attorneys plus other employees, are they eligible for coverage?
As long as the other employees waive and are full-time, yes.
All right. Any other questions that people have? My chat box said there were 8 new questions, but I was scrolling down and I don't think it was taking them off. So,
well, thank you so much for that.
There were a lot of great questions that were coming in. Is there anything that we covered that you want to dig into a little more or ask for some further clarification? I wanted to ask a question. I thought that I had seen recently in our review of the coverage that this plan had actually been upgraded to include some commonly prescribed mental health medication, just as a result of what we're going through with COVID. I just want to make sure, is that accurate?
I would actually have to do further research into that, Annette, as to what specifically that entails, but I believe you're correct. I just don't know the details off the top of my head.
Okay, I want to say that I thought they were taking steps to address mental health needs and had done some very positive things to include those in coverage, which, given the impact of COVID, I thought that was a really good move on their part. So
Absolutely.
Just something I wanted to stress.
Well, real quick, in regards to mental health, the health plan does have to follow mental health parity. So that means that mental health has to be covered the same as any other sickness or illness. So when it comes to a copay plan that might have a $25 copay charge for a doctor visit, they have to charge that same copay when they see a mental health psychiatrist or psychologist.
We did get another question, Wendy. I live in far western Wisconsin. How many carriers cover this area, or is this policy only WPS? And if so, is there a robust coverage in western Wisconsin?
We do have coverage in Western Wisconsin, absolutely. I've worked with clients out of, I want to say Howard, so I'm not quite sure how far west we want to go, or Northwestern, La Crosse area. But the WPS statewide network, again, we're talking about 98% of everyone in the state. So we should be good. Again, feel free to contact us for quoting, because when we do provide you with those preliminary rates, we also provide you with more details about the statewide and Select Plus provider networks, if that's something that will fit for you as well.
And this is actually the Hudson area is the follow-up information provided. So does that ring a bell? Is that something where you have a lot of carriers? I mean,
Yes.
A lot of providers, excuse me, I use the wrong term.
Yes, we should be just fine. And keep in mind, I know in that Hudson area, you also like to cross the border and go over into Minnesota. So that's a perfect example of where, well, I think is it preferred one we have in Minnesota? I think, don't hold me to that. Minnesota has a little bit different of a network than First Health does. And WPS has contracted with the stronger network. So I think it's preferred one, but I'd have to confirm that.
I'm just curious, are you seeing, as a result of this option now being available for law firms, are you seeing smaller firms sign up because previously they weren't able to provide this type of benefit for their employees or their attorneys, and now it's much more accessible?
That's a great question. I think a couple of things that I would comment on is, we have, that's exactly where I was heading, Marilyn, thank you, is, with the State Bar Association health plan, in addition to writing a group of one, if we can, in addition to counting a full-time employee as someone who works 26 or more hours per week, the other thing that is unique is contributions. Now, in a 2 to 50 ACA community age-rated world, you have a mandatory 50% employer contribution, at least of the single premium. In our world, under the State Bar Association health plan, it's open. You can set that at whatever you're comfortable with. And then again, like I say, if you want to get into multiple plans, you can set a contribution on a base plan and allow employees to buy up. So I think it's a lot of things. I think that it comes from, we composite rate instead of age rate. And then also having the capabilities to have multiple plan designs in place. And it only takes 2. So I have clients that have 2 plans in place and only 2 employees on the plan, 1 on each plan. So it's definitely something where we are seeing a stronger uptick, that is for sure, with our smaller law firms.
All right, I'm going to make one more last call for any questions that you might have. You came with some great questions. This has been a really fabulous session, just to hear from all of you in terms of the information you're looking for. I don't see any other questions. I do want to just give you a reminder that we will be sending out the PDF of all of those kind of images that you saw on the slides Wendy shared today. You'll be getting those from us shortly after this call. And just wanted to remind you that if you are attending the Solo Small Firm Conference, excuse me, we have another webinar session just like this. It'll be covering different topics. It won't be covering the same information, but it is certainly an opportunity for you to bring questions. And that will be held October 29th, which is a Friday at noon. So grab some lunch, tune in, and bring all your questions that you have for the chat box. And then I also wanted to just remind you that on this last screen here, Wendy still has it up, is her contact information, email and phone. Some of these things are just, some of these questions are just better handled by connecting with Wendy, or Christine is another benefit specialist at our professional insurance program partners. And feel free to reach out. They would love to be able to help you and answer those specific questions that you have in mind as you're kind of looking at this. One final reminder, you can change into the health plan at any time. I know that this is kind of a topic that comes up at this time of year because November 1st typically marks the opening of our open enrollment period. But when you are, correct me if I'm wrong, Wendy, when you are actually switching plans, you can go in and out and switch at any time during the year. So this is a great opportunity to start to collect the information and take a look at some cost comparisons and do what's best for your firm, obviously. But this has been proving to be a very good move for many firms in the state. So with that, I don't see any other questions coming in. Again, thank you for joining us. Wendy, thank you so much for your time and for your, we do have one more question here. When is the enrollment? Wendy, I'll let you answer that one.
Okay. So as Annette was leading to, group health insurance plans can be set up at any time. So if you wanted to look at November 1st effective date, we can do that. December 1st, January 1st, anytime pretty much throughout the year, we can set up a group health insurance plan. This annual open enrollment that you keep hearing about that starts on November 1st and runs through December 15th really is only for individual plans. So you don't have to worry about that when it comes to group health insurance.
And don't be concerned about your deductibles and things like that. As I've learned, as I've been working with this plan, that those transition as well. And Wendy and she can fill you in on all the details that go along with that. But don't let that be a deterrent for you, because there is a way to work with that and be credited with what you have accrued in terms of a deductible at any point that you transition from one plan to another.
Yeah, we can definitely talk more about deductibles and anniversaries and plan years and how things work that way one-on-one.
All right. Well, I think we have covered everything and we have stayed within our time frame so that we're not taking additional time out of your schedule. Again, thank you so much for coming. And we appreciate your time focusing on this. Feel free to reach out if there's anything I can do to help you out. Again, my name is Annette Ashley. I'm going to give you my email address. That's the easiest way to get in touch with me right now. ashley@wisbar.org. Feel free to let me know if there's anything I can provide to you. And Wendy's information is on the screen here. When we send out the information to you this afternoon, I will include their contact information as well so that you have quick and easy access to reach anyone there for more questions. Thank you again, and enjoy the rest of your week. Bye.
Thank you. Bye-bye.